The patient has been transported to Kennestone Emergency Department, showing signs and symptoms of a stroke.
Are you hurt anywhere? Your head hurt? Do you have any problems with your vision? No? Can you squeeze my fingers for me? Good. Can you hold your hand up like this? Hold them both up real high. Try again, hold up real high. Okay, put it down. Can you pick your legs up for me? Can you raise this leg? Good. Lay it down. Can you pick this one up? Try to hold it up for me. Hold it up real high. Okay. Alright guys, looks like you got an acute stroke in the hand.
Due to the patient's presentation, the physician has ordered a CT scan and to alert Air Life Georgia to stand by for helicopter transport to the Marcus Stroke Center at Grady. The closest available aircraft will either be placed on standby if Kennestone is still awaiting final acceptance from Grady, or will be asked to respond if Kennestone has already received final acceptance.
Airline 5, go ahead.
Airline 5, Aircon, we have to stand by. Kennestone Hospital will be a helipad transfer. Kennestone Hospital, helipad transfer. Patient going to the Marcus Stroke Center in Grady Memorial. Stand by.
The crew will be provided minimal patient information initially to include patient weight. Destination will always be the Marcus Stroke Center for these transfers. Whether the patient is on TPA and at what rate. Whether the patient will be brought to the helipad holding area or if the crew will be meeting the patient in the ED or ICU. This depends on whether the patient is stable or not. If placed on standby, the crew will prepare the flight as they would for any standby and be ready to launch when requested. If the aircraft responding is any other than Air Life 5, this will be an air standby.
Aircom, this Air Life 5, weather's good.
Aircon, okay, weather good.
Crews should attempt to pre-program the mini-med pump for the TPA drip in advance of their arrival to Kennestone whenever possible. This will minimize the amount of time the drip is placed on hold for the transfer. Upon returning from CT scan, family, physician, and staff consult regarding definitive care. The decision has been made to initiate TPA therapy and transfer the patient to the Marcus Stroke Center via helicopter.
Hey, this is Joe, Kennestone Hospital. How you doing? Fine. Just letting you know we are going to fly that patient to Grady. He'll be going to the stroke room. All right, we will meet you on the helipad. Okay, we'll have security and we'll meet you up there.
Once the flight is confirmed as a response and the crew completes their safety walk-around and other safety measures, Air Life 5 will call out via Med 3 radio to Kennestone and let them know they are lifting and anticipate a 5-minute ETE. Any other aircraft will call via Med 3 radio to Kennestone when they are 5 to 8 minutes out from landing.
The Air 5 copies. This is a go flight now, correct, Kennestone?
Air 5 affirmative. This is a go flight.
Kennestone Comm Center, Kennestone Comm Center, it's helicopter Air Life 5. Hey, you copy?
All crews, regardless of which base is responding, will confirm during their ETE notification as whether they'll be meeting the patient in the helipad holding area or the ED or ICU. when Kennestone receives the ETE notice from the flight crew, staff will proceed with the patient to the helipad holding area. There will be an extra stretcher without pads available in the helipad holding area for flight crew to place their sled on. Both the extra stretcher and the stretcher with the patient will be in the helipad holding area with the foot of the stretcher pointing towards the helipad.
Looking good, Bob.
Pretty right.
Upon arrival to the helipad, the flight crew will exit the aircraft hot with the aircraft sled while following all safety procedures. The crew will meet the patient and hospital staff in the helipad holding area. The flight crew will perform a rapid assessment and determine if the patient is stable for flight. If for any reason the flight crew determines the patient is too unstable to fly or needs a definitive airway prior to departure, the crew and the patient will return to the ED and appropriate interventions will be performed there.
When you're ready for a report. There's going to be a lot going on, okay? Patient registration, 50-year-old female who was in a last known normal time was approximately 8:50 this morning.
Once the assessment is performed and the patient is deemed stable enough for flight, the sending nurse will provide a brief report as the flight crew moves the patient to the aircraft stretcher and secures appropriately. The hospital staff will provide the flight crew with the following: stroke transfer report and checklist, a TPA infusion record if the patient is on TPA. The flight crew will need to continue this infusion record en route to Marcus Stroke Center and provide that record to the staff upon arrival. The signed EMTALA form, the Air Methods Consent to Treat CTT form, signed by the patient or family member. The flight crew will need to fill in the top sections of the CTT form, but Kennestone will already have obtained a signature from the patient. All other paperwork to include labs, X-ray, and CT results, nurse and physician notes, etc., will be faxed by Kennestone staff to a secured number in Marcus Stroke Center. The flight crew will not wait on paperwork or CT film. The flight crew will provide the patient with a standard safety briefing and ensure hearing protection has been provided to the patient by Kennestone staff. The flight crew will transport the patient to the aircraft for a hot load with the assistance of ED staff as necessary. The TPA drip, if present, will be placed on hold and removed from the Kennestone pump just prior to loading the patient into the helicopter. The TPA drip will be restarted as soon as reasonably possible once inside the aircraft. To restart the TPA drip, the flight crew will connect half-set tubing to the end of the Kennestone tubing and prime the TPA through the half-set. The half-set cartridge will be placed in the mini-med pump and the rate will be set as per the patient weight and orders from the sending MD. The flight crew will ensure the hospital staff assisting the hot load has safely exited the rotor system. Once the patient is safely loaded and secured appropriately in the aircraft, AirLife will now depart with the patient to Grady. Upon departure, notify ComSpec to advise Grady of an updated ETE and to meet the aircraft on the helipad. The remainder of the transport will proceed typically as any other mission. Upon arrival at the Marcus Stroke Center, the flight crew will be met by staff who will escort the patient and flight crew to either the CT angio suite or the neuro ICU. The receiving physician at the Marcus Stroke Center will sign the physician's certification statement. The flight crew will provide Marcus Stroke Center with a stroke transfer checklist and the TPA infusion record and maintain copies of both to upload into EMS charts. The flight crew will alert the medical base supervisor of any issues regarding the transfer. The medical base supervisor will alert the area medical manager of any issues, so appropriate follow-up can occur between Kennestone and Marcus Stroke Center. All Kennestone to Marcus Stroke Center transfers will be reviewed monthly by the area medical manager, and appropriate follow-up with the medical base supervisors, flight crews, Kennestone staff, and Marcus Stroke Center staff will occur.